just I suppose start with what's come out this afternoon is the additional funding from Treasury, or additional money. Well, I was going to say how much is that, but they've told us it's, as we come in the door actually, got this in 800,000. What's that money going to be going towards?
So that money will allow us to reinstate outpatient appointments and routine operations and procedures during February and March, which ordinarily in our original plan agreed by the board at the beginning of January, we were pausing until April in order to mitigate our financial position.
And just in terms of financial position, so in the release again that came out this afternoon, it said it was going to be expecting to have got the overspend down to about 10 million. That's gone looking like about 15 again, is that correct?
That's right. So our current overspend position is forecasted to be 14.7, but we have confirmed with Treasury and with the Department of Health and Social Care that we will not exceed 15 million, and that has been requested of us by government.
Just in terms of where this is, what services are going to be impacted immediately, sort of thing?
So the services as described, so we are asking our off-island providers, the people who we have contracts with in the Northwest, to look at their waiting lists and pause routine activity for those 2 months. So tertiary spend, the money we spend with off-island providers, costs us around £32 million per year, and that is overspending significantly. And we know that is partly because people are going back there for outpatients that potentially we could do here on the island, or we could convert those to virtual outpatients, and that would all help us with our financial position. So we are working really closely with those providers in order to try and mitigate our costs. I mean, clearly if people need that care off island, then they should have it. But what we do want to do is have the opportunity to look at how some of that activity is being delivered, repatriate cases back to the island where it's possible to do so, encourage those providers to look at different ways of doing that. So, you know, virtual outpatient clinics are very, very popular and should be used where possible in order to make it better for the patient, but also to prevent the costs of travelling too. So it is about that dialogue with those Northwest providers, because actually it's not sustainable for us to continue significantly overspending on those contracts as we move into the next financial year. Activity that is unplanned, so these are things like a major trauma case that needs to go off island, cancer care that would need to go across for radiotherapy, for example, or for cancer surgery. All that will still happen, but we are trying to look at where we can reduce some of the costs, and as I say, outpatients and diagnostics that we could do here, it would seem sensible to try and reduce those costs.
It almost seems a bit, this is going even before Manx Care, so apologies slightly for that, but I remember when this was a thing before, pre-COVID, pre-Manx Care, that the government was going down that route when DHSC was in charge. It almost seems weird that we haven't got to more people doing that sort of appointment by this stage anyway. Is that just something that hasn't been a priority up until now? Or?
I think we haven't had the infrastructure and the facilities, and I think what we have to do as an organisation who is responsible, not only do we deliver our own services here, Manx Care is responsible for contracting those £30 million worth of services with the Northwest, is really have that dialogue which you know, makes them look at those different ways of delivering the services which are more cost effective and sustainable. Now we know the UK NHS, it's standard to think about virtual outpatients rather than bringing people into the hospitals, but that hasn't happened routinely for patients from the Isle of Man. And I think that's the difference and the contract negotiations we want to have with those providers. As I say, if people need off-island care and it's appropriate, then of course that will still continue.
And just in terms of on island, you've said about the additional spending will help to secure as much of the planned procedures can go ahead as possible. In terms of the ones that won't go ahead, where are we at with that?
Yeah, so obviously when we took this decision at the beginning of January, rescheduling or taking down that activity, redeploying staff who would have ordinarily done that activity, it needs a substantial amount of planning. So with this additional money that we were advised of at 10:30 this morning, we will be able to reinstate the majority of outpatient clinics. We'll still be able to do the waiting list validation work that we had planned to do during that time, and we will be able to restore a number of routine operations and procedures. But we obviously have already redeployed and made arrangements for those staff to do different things or stood staff down. So it will take us a few days to reinstate that and put that in place. We know a small number of people have already had their appointment cancelled, and obviously we'll get those rebooked as quickly as we can.
Just in terms of, part of it was said about reducing the inpatient bed complement. People hear that and they hear that that's wards being closed. Like, what actually does that mean in simple terms to people?
Yeah, and realistically now, because we're still going to be doing the surgery on island now, and that's been reinstated, that ability for us to reduce our beds, perhaps close a ward, isn't going to be possible now, because obviously we will be doing the surgery as planned. So by prior to the action announced this morning, it would have allowed us to have perhaps reduced a ward on the Noble site, and that would have allowed some of our planned preventative maintenance to have taken place. But we will obviously rethink those plans now.
Just in terms more of the finances, you said that you got confirmation this morning that that money would be available. When was that request put in? Is this something that has suddenly come forward, or has it been the one that Treasury's mulled over for a while?
So we've obviously been discussing our finances throughout the course of the year. So at the start of the year, Manx Care had to achieve savings of £19 million in order to achieve financial balance. As we tracked through the course of the year, we knew that target was not going to be achieved. And that resulted in us announcing some extra savings plans in September.
Well, going back, the Chief Minister, when he was Health Minister, said it was before the start of the year that was never going to be achievable.
Well, I think it was an ambitious target, but actually, in order to keep delivering the services in line with our mandate from government and delivering all the services we've been asked to deliver, in order to achieve a balanced budget, that required the organisation to find £19 million worth of cost improvements. Yes, that is a big ask. Ordinarily, the evidence tells you that provider organisations realistically achieve between 2 and 2.5% of cost improvements, which would ordinarily mean Manx Care delivering between £7 and £9 million per year. So 19 was always a very ambitious ask, but we absolutely attempted to do that. What we will have delivered this year is £15 million worth of cost improvements, which is sort of double. So it's about 4%. So double what ordinarily we would have been expected to do, exceeding the cost improvement target that was outlined in Sir Jonathan Michael's report and the funding formula. But obviously, the additional costs of healthcare, the additional costs of frontline care, the increases in demand we have seen have meant that we are spending more money every month than what we have the budget for. And that meant that, in order to not go beyond the £15 million overspend, we needed to take some additional action, which was agreed in January. Now, those discussions around our finances are ongoing and constant. There won't be a week that goes by when we're not discussing our finances and being able to provide assurances about what we're doing in response to our financial position. So, there's two sides to this. We recognise taking that action during those last 2 months is really impactful for patients. We don't underestimate that, and we've focused on what has the least impact from a quality and safety perspective, but what also can take costs out. At that magnitude, trying to save around £2 million for the last 2 months of the year. There aren't many courses of action that we can take in order to take that level of money out of the organisation in 2 months. So yes, it's welcome that we've had this additional decision today. And that allows us to reverse out some of that planning and the decisions we made sort of 21 days ago.
In terms of the actual funding for the year, I think it was 347 that was the budget given. And then there's always that, as at the time the Treasury Minister said, there's 2%, it's going to ensure we're going to be on budget, and what has happened since then. But also people do keep going back to the Jonathan Michael report, which is up there the 10 Commandments in terms of how people look at it for some reason. But do you think that that is actually realistic to ever get to that funding level?
No, I think it's probably not realistic for the economy. We know.
Then they were a low tax economy with
high demands, an elderly population. So those two things do not correlate. There is a misalignment between those two things. We have a very ambitious mandate with an awful lot of standards to achieve, and we have made best endeavours to deliver as much as possible. But the fact is, we've got elements of our responsibility for commissioning which are uncontrollable. So this is why it's really important to try and get a better grip on that, because some of our treatments, placements, we can have a high cost placement which will cost £500,000 per year, and you only need 2 or 3 of those to have massively impacted the finances of the organisation. So I think the Sir Jonathan Michael's recommendations, they're now 6 years old. They were done at a time in a very economically different climate. They were done pre-COVID, and they were also done pre-comprehensive inspection from CQC and Ofsted, which, to be fair, has presented in 2022-23 a sort of new baseline of what are the key things that need to be delivered and what are the standards for the island. I think it's unhelpful to keep coming back to Sir Jonathan Michael's recommendations, because I just don't think they're possible. We know the impact of health and care funding has on the wider economic position, and we know if healthcare overspends, the detrimental impact that has on the wider finances of government. So, everybody is in a very difficult position. Hence, moving forward, what Chief Minister outlined in October is this desire to make sure Manx Care has a mandate which is properly costed and fully aligned with the budget available. So hopefully we will move away from that misalignment, and it will be really, really clear to everybody concerned what that money buys. So what is the level of healthcare provision that the island can have for the budget it has available. So that's where we are working really hard with the Department and Government to get to that position, and then to be able to sort of have those conversations with the public, which is really, really important, because I think what we must not do is continue to have this position whereby we're not honest with the public about the impact of some of these budgetary pressures. That's just misleading. That's not correct. We need to modernise many of our services. They need to be demonstrating productivity and efficiency, and that's why it's really important we tackle some of those long-standing legacy issues around productivity and efficiency in this system, and also modernise. There are very different ways of delivering healthcare, and as an island we perhaps haven't taken as many of those opportunities as what we could. There is one thing I would like to pick up on is there has been some suggestion that these additional savings are as a result of the settlement with the doctors. And those two things have been connected up. I would like to stress that those two things are completely not connected. These savings have been ongoing, and obviously were part of a suite of measures and agreed at the beginning of January. The additional funding which was provided to Manx Care in order to negotiate what was a settled position with the doctors, that has come from the Department of Health and Social Care. So that is not from within the Manx Care budget. Manx Care was always clear what it could afford to offer doctors, and it couldn't breach that. And so we have managed to settle, but obviously with additional support from the DHSC.
Just on that, are we able to get confirmation of how much extra money this is? Because Minister spoke and Tim Walden didn't give a figure and didn't really explain where this money was coming from either at the time. It's sort of gone around. That's the first time that we've been told where this money's actually come from. Do we have how much that's actually going to be? So
we're still working through the final figures, but it's around 2.2 million to sort of the extra, and then approximately the same amount moving forward on a recurrent basis that will need to be brought into the baseline. We're still working through that details, but that's the indicative numbers that we have worked with in terms of reaching resolution with the BMA. I genuinely wouldn't want those two things to be connected. Our doctors deserved and negotiated a better pay settlement, and cuts to services, reductions in services are not being enacted in order to fund that. And I think I want to make that really clear.
The final sort of thing is, people obviously look at what's been announced there and they'll be wondering when they'll be seen next year. What sort of impact do you expect us to have in the first sort of 3 months of the next financial year especially?
We are really still not clear on that. So we will be producing a sort of an operational plan for Manx Care, which will be very clear about the budget for each bit of service and what that really means. We are building in a level of productivity and efficiency, and as soon as we're able to have that clarity and get that signed off, we will communicate. But effectively, we will not be able to deliver the same level of activity next year as what we have for this year. We are attempting to modernise, we want to drive the efficiency, as I say, but the likelihood is there will be a reduction in activity. As I say, we will have delivered £15 million worth of savings in this financial year, and I think that shouldn't not be acknowledged. That's a substantial amount of cash out, cost improvement savings. We will probably need to do something in the same range next year in order to hit financial balance. And as I say, now we have settled with the doctors, we want to use that opportunity to job plan consultants and doctors and other professionals and understand what that means in terms of service planning